be doing something when you have this recurrent UTI. And also even addressing if it is recurrent, and even if you're doing the right things, what does all this mean? Because one thing we're seeing is, for a lot of different reasons, lack of research in women's health, medical gaslighting, women not having time to go see their doctor. There's a multitude of reasons why the recurrence may be happening. And so I think it's just important, indulging me. Now, some have talked about Tylenol and ibuprofen. I guess one, where do those help, and do they, and does it matter if you take ibuprofen or Tylenol?
This is an interesting one. It's actually not the cranberry juice. It's actually, there's something in it called D-mannose, and D-mannose is a monosaccharoid that actually is from a type of tree, a large tree. And what it does, D-mannose, and it can be used actually if you're someone who has a lot of urinary tract infections for prevention of it, although the data is a little bit mixed. But D-mannose actually binds up E. coli and doesn't allow E. coli to bind to the bladder wall, and that's how it works. So it's not actually the cranberry juice itself. If you're someone who doesn't like cranberry juice, you can get D-mannose capsules as a supplement and take that instead. Yeah.
Okay.
And if you're someone who has recurrent UTIs, you have 2 or more in 6 months, or 3 or more in 1 year.
Okay. Now, what about if you do have that really short urethra? What happens if that's what's causing the UTI? Do you have to get surgery to get that fixed? What does that mean?
No, not usually. I mean, unfortunately, at least the reason why. But
Okay.
You're going to go back to the same sort of modalities that anyone else would do who has recurrent urinary tract infections.
Got it. Okay. Which is you're talking about more the prevention and being really diligent about the preventative